You are welcome to the International Herbal Medicine Centre, England. This episode is titled, Danger of Inflammation Exposed. Please remember to subscribe to our channel. Inflammation is natural bodily response to trauma and infection. It helps to rid the body of invading organisms and toxins, and also helps to mop up any dead cells and tissues. Without inflammation, injured tissues would not heal and infections would rage out of control. But chronic inflammation, also known as chronic systemic inflammation, is an inflammation immune response of prolonged duration that eventually leads to tissue damage. During the inflammatory process, immune cells release various chemical signals called cytokines, which help regulate the immune response. These cytokines attract immune cells to the site of injury or infection, promote blood flow, and facilitate the removal of harmful substances. While inflammation is crucial for the body's defense and repair mechanisms, it needs to be tightly regulated. Excessive or uncontrolled inflammation can lead to tissue damage and contribute to chronic diseases. One of the most destructive inflammatory molecules is called nuclear factor kappa B, a little molecule that creates a lot of damage. It can be activated by emotional stress, toxins, free radicals, and toxic, inflammatory, or allergic foods. When it is activated, it can unleash the production of a host of inflammatory molecules, a steamroller of inflammation that affects your whole system. There are two main types of inflammation: acute inflammation and chronic inflammation. Acute inflammation. Acute inflammation is a short-term, rapid response that occurs when the body is exposed to harmful stimuli. It is characterized by symptoms such as redness, swelling, heat, pain, and sometimes loss of function in the affected area. This type of inflammation is typically protective and helps the body fight off infections or repair damaged tissues. Examples of acute inflammation include a cut, a sprained ankle, or an infection like a sore throat. Chronic inflammation. Chronic inflammation, on the other hand, is a prolonged and persistent inflammatory response that can last for weeks, months, or even years. It is often a low-level, systemic process that may not produce the classic symptoms of acute inflammation. Chronic inflammation can result from ongoing exposure to irritants, autoimmune disorders, or conditions such as obesity. Over time, chronic inflammation can contribute to various health issues, including cardiovascular diseases, diabetes, certain cancers, and autoimmune disorders. Treating inflammation involves addressing the underlying causes and reducing the symptoms to promote healing and prevent complications. The approach to treatment can vary depending on whether the inflammation is acute or chronic, as well as the underlying condition causing the inflammation. Here are some general strategies for treating inflammation. 1. Rest and protection. In cases of acute inflammation due to injuries or overuse, resting the affected area and avoiding further stress can help reduce inflammation and promote healing. 2. Prescription medications. In some cases, your doctor might prescribe stronger anti-inflammatory medications or other drugs to address the underlying cause of inflammation. These might include corticosteroids, disease-modifying anti-rheumatic drugs, DMARDs, or biologic. Applying cold compresses or ice packs to the inflamed area can help reduce swelling and numb pain. This is particularly effective for acute inflammation. 3. A cold compress, also known as a cold pack or ice pack, is a medical or therapeutic device used to apply cold therapy to a specific area of the body. It typically consists of a pouch or a cloth filled with a gel, liquid, or other substance that can retain cold temperatures for an extended period. Cold compresses are often used to reduce pain, swelling, and inflammation in various injuries or medical conditions. When applied to an injured or sore area, a cold compress constricts blood vessels, which can help reduce blood flow to the area and subsequently decrease inflammation and swelling. It also numbs the nerves in the area, providing temporary pain relief. 4. Pain relief. Over-the-counter non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or aspirin, can help alleviate pain and reduce inflammation. However, these should be used under the guidance of a healthcare provider, especially for chronic conditions. 5. Lifestyle modifications. For chronic inflammation, lifestyle changes can play a significant role. These include 6. Diet. Consuming a balanced and anti-inflammatory diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help. Foods like fatty fish, high in omega-3 fatty acids, berries, nuts, and turmeric have anti-inflammatory properties. 7. Weight management. Obesity is associated with chronic inflammation. Maintaining a healthy weight through diet and exercise can help reduce inflammation. 8. Physical activity. Regular exercise can help regulate inflammation and support overall health. Engage in activities that you enjoy and that are appropriate for your fitness level. Stress management. Chronic stress can contribute to inflammation. Stress is a major contributor to the inflammatory responses. As we learn to relax and let go of toxic emotions such as anger, resentment, rejection from others, self-rejection, worry, fear, and bitterness, we can move into a place of peace with ourselves and others. Techniques like meditation, deep breathing, yoga, and mindfulness can help manage stress. 9. Diet recommendation. What you eat is highly essential, and even routine exercise helps. You have the power to change them and heal your body. Taking the following step will help. 10. Reduce your intake of meat. Animal products are the primary sources of arachidonic acid, a fatty acid that is converted to hormone-like substance called prostaglandins and leukotrienes, substance that can aggravate the inflammatory response. 11. Avoid sugar, refined carbohydrates, refined table salt, and junk foods. Excessive consumption of sugar, especially added sugars found in processed foods and sugary beverages, can have various negative effects on health. Salt, sodium chloride, is an essential mineral that the body needs to function properly. However, excessive salt consumption, particularly in the form of sodium, can have negative effects on health. There are several negative effects associated with consuming junk food on a regular basis. Junk food refers to highly processed, low-nutrient foods that are often high in calories, sugar, unhealthy fats, and sodium, and low in essential vitamins, minerals, and fiber. Managing underlying conditions. If inflammation is linked to an underlying condition such as autoimmune diseases, e.g., rheumatoid arthritis, lupus, or chronic conditions, e.g., diabetes, cardiovascular disease, managing those conditions effectively can help reduce inflammation. Complementary therapies. Some people find relief through complementary therapies like acupuncture, massage, or herbal supplements. It's important to consult a healthcare provider before trying these approaches. Increase omega-3 fatty acid. Omega-3 fatty acids are indeed beneficial for the body and play a crucial role in maintaining overall health. Omega-3 fatty acids are a type of polyunsaturated fat that the body needs for various physiological functions. Remember that the approach to treating inflammation should be tailored to your individual condition and circumstances. This is an educational video. Always seek guidance from a qualified healthcare professional before making any significant changes to your treatment plan.